Well, good morning. We had everybody's had a good breakfast, good fun, great. And remember, you don't have to attend everything today. So if we tire you out, just take a break, and you can always watch it when you get home on, as our guests are on the internet, you can always watch it on the internet. And the nice thing about having the internet broadcast is you can show it over and over and over again. So one particular speaker you liked, or you saw some mistake that was really egregious that I did and you want to laugh about it, you can watch it again, and it's all there. And that's one of the reasons we record it and make it available for you, is because there's so much information in this weekend, it's hard to get it all. And I'm sure, just like I enjoy giving these presentations over and over again, I can imagine you would enjoy hearing good presentations over and over again. I've had many longtime friends in this business, but none of them go longer back than our next guest speaker. This is a man who I had a chance to work with 30 years ago. We had both of us a little more hair at that time. We were both still fairly trim at that time, and as you can imagine, we're also stronger and handsomer than we were back then, both of us. But this is a man who's a medical doctor. He's been extremely active at trying to share with people the importance of a healthy diet, which has been a trend towards vegetarian or vegan diets. I'll let him tell you about the extent of that enthusiasm. He's had a chance to take care of patients in a practical way, so he's a real doctor. I mean, there's a difference between academic doctors who really never get their hands dirty with patients and people who, like myself and Dr. Michael Klaper, we love nothing more than to be able to get out there and to touch patients, to learn from them. That's the greatest education you get, is from patients. And our next speaker, Dr. Michael Klaper, has spent his life being a real doctor, and he's going to have a chance to tell us about some of that life in his next presentation. I think you'll find this extremely entertaining and very educational. So welcome, Michael. Nice to have you here.
Thank you. Thank you, John. It's certainly an honor to be here at this fine conference and to address all these wonderful people interested in healthier living. When John asked me to address the group, I said, John, what can I say? I'm not a specialist. I'm just an old country GP, and I really don't have much to share with your audience. And he says, well, just tell them your story. Tell them how you got here. I've been a physician for 40 years. And he says, surely there must be something that you've learned along the way that you can share. Just tell them your story. So I said, well, okay, fair enough. I'll tell you the story of how I got here. And so I'll share that with you this morning. To understand how I came to be standing up here, we have to go way back to the year 1968. You remember that year? It was a very tumultuous year, exciting year. We were a very different country back then. We hadn't made it to the moon yet. That was still a year away, but we were working frantically to get there. There were some heroes stalking the countryside. Robert F. Kennedy was still talking to Mickey Mantle back then. John and Yoko were doing their bed-in for peace. Dr. Martin Luther King was trying to wake us up to the importance of treating everyone as equals. If you want to make a phone call, use one of these. If you wanted to listen to music, you use one of these. If you wanted to record some music, use one of these. And if you wanted to write a letter, you use one of these. For those people still with black hair in this audience, this is a typewriter. And if you want to give a slideshow, use one of these. Remember, next slide. Next slide. If you wanted a hot car, you got one of these. Yeah. 60, forgot yours. Right? All right. 68 Mustang. If you wanted a really hot car, you got one of these. Oh, got a Stingray, you bet. And if you were 20-year-old me, you began to fill your lifetime ambition to become a physician by enrolling at the University of Illinois College of Medicine in Chicago at the Medical Center, where I joined the freshman class where I looked like that. Ooh. That's right, there was more hair back then. You're right, yeah, exactly. I will point out to you the 4 of the 6 women in our graduating class of 206. They're all grandmothers by now, I'm sure. But I'm happy to report to you that the 2012 graduating class of the University of Illinois College of Medicine was composed of 61% women. Yes. Familiar faces, Paul Newman looked like that. As a baseball fan, one face I remember was the fearsome scowl of fastballer Bob Gibson of the St. Louis Cardinals, who mowed down the Detroit Tigers in the 1968 World Series. But the face that many of us remember that typified these tumultuous years was this one. And President Nixon often had a scowl on his face because in the background of every morning he woke up, the Vietnam War was raging. And it showed us things that Americans never seen in their living room, images that showed us not as benevolent folks, and the reality of war. The war, in turn, fueled civil unrest back at home. The civil rights movement was becoming militant, and it showed up in many places, including the '68 Mexico City Olympics. The tumult boiled up. Young men were burning their draft cards, refusing to go to war. And this finally resulted in the riots at the 1968 Democratic Convention in Chicago, where I found myself helping to patch up heads in the first aid tent in Grant Park. It was a time of great conflict. Forces of dark and light were at odds with each other, including in my own heart and my own being. But I knew I wanted to side with the forces of light and peace. I knew that. Doctors were portrayed lovingly and with great respect in the public's eye. Dr. Albert Schweitzer, a name that many young people don't even know anymore, was doing magnificent work at his clinic at Lambaréné in Gabon, in Africa. Dr. Tom Dooley was doing wonderful work with the orphans of Cambodia, while Canadian chest surgeon Dr. Norman Bethune was doing remarkable surgery in the far hinterlands of China. Dr. Jonas Salk had devised an immunization to stop the development of polio, and he gave it to the world for free, didn't make a penny off of it. Dr. Michael DeBakey was showing us how to repair hearts that people thought were damaged beyond repair. And as a result of all this noble work in medicine, doctors were portrayed in a very sympathetic, positive, even romantic light in the media. Oh, Marcus Welby. Turn on Gunsmoke, you saw kind of the old Doc Adams up in his office, patching up the guys who got shot by Matt Dillon. Remember sexy Ben Casey? Ooh, hot guy, right? Mm-hmm. And me, I was learning how to practice real medicine at the University of Illinois. And I found myself, though unbeknownst to me at the time, I was actually learning medicine in the temple of the way it is. After all, my professors told me this is the way it is. This is how the body works. This is how disease happens. This is the way it is. This is what you do about it. Go out and do it, and don't ask questions. Okay, fair enough. And in that dogma from the temple of the way it is, I learned some things that I thought were rock solid stable. Ulcers in the stomach and the duodenum are caused by stress, and people are putting out too much stomach acid, they're drinking too much coffee, no wonder they burn a hole in their stomach lining. Atherosclerosis is a relentlessly progressive, irreversible disease. Once your arteries clog up, there is nothing you can do about it. High blood pressure, oh boy, you put patients on antihypertensive medications, they will take these pills the rest of their lives. This is lifetime medication. Nobody gets off high blood pressure pills. And you got patients with diabetes, oh, the thing, once on insulin, always on insulin. Nobody gets off insulin. It's absolutely essential for life. That's the way it is. Well, I studied hard for 4 years, and in 1972 got my degree as a doctor of medicine, and at McCormick Place in Chicago, I walked across the stage, they handed me my diploma, and called me doctor for the first time. It was my late brother, Bob. I took my National Board of Medical Examiners exam, and I needed an internship, so I headed north of the border to the beautiful city of Vancouver. And went to Vancouver General Hospital, where I did my medical internship 1 year as a straight internal medicine resident. I got my certificate of internship, passed my LMCC exam for the National Boards for Canada, got my British Columbia medical license, and headed out into general practice. I love being a GP. You get to have such intimate contact with people's lives and help them in very meaningful ways. And I did things back in the 70s that I would never think of doing today, and one of which was delivering babies at home. And I did quite a number of, several dozen home deliveries. And it's a sacred and beautiful and powerful scene. And here's a baby coming out. Notice my 1970s sideburns there. We did what's called laborious delivery. The baby would come out. We would, instead of in a bright operating room, we would turn down the lights. And when the baby came out, we would put them in a bath of warm water to reproduce the conditions in the womb. Baby sure seemed to like it a lot. And the expression on the mom's face when we put the baby in her arms made all the risks worthwhile. And I really loved doing home deliveries. Would not consider it today. Back then, the ambulances looked like this. People did a lot of that. In fact, if you were in a restaurant after a meal, it was commonplace that people would light up and fill the restaurant with smoke. You could even smoke on airplanes. There's the late, great Pan Am. And boy, I never found that scene comfortable when I walked into the airplane and saw that sign. Somehow, the non-smoking section of the airplane always felt like the non-chlorine part of the swimming pool. You know? We knew better. Back in 1964, Surgeon General Luther Terry told us that cigarette smoking will kill us, but it took us quite a number of years to catch on to that. It was an exciting time back in the late 70s. We were starting to do imaginative surgery. We were replacing hips, doing total joint replacements, and watching people crippled with osteoarthritis get up the next day and walk virtually pain-free. How exciting. My colleagues in ophthalmology were restoring people's sight that had gone opaque from cataracts, and the lens of their eye had become opaque. In 20 minutes, they could go in, remove the old lens, drop in an implant, and give someone who was totally blind crystal clear vision. What a miracle. We learned how to stop the heart and repair it. We could keep the heart absolutely quiet for long hours on end. What a remarkable advance that is. The birth control pill made its advent during these years, and that set off the sexual revolution, whose sequelae we experience today. But not only stopping conception, we actually got into the mechanics of conception, and this is the time that we were actually able to fertilize the ovum in vitro in glass. And as a result, in 1978, Louise Brown was born, the first test tube baby. And by the way, 34 years later, Louise Brown has children of her own. During these years, I was privileged to see the abolition of an age-old scourge. I saw smallpox banished from the face of the earth. And this was a great relief for me, because I always had great trepidation about ever having to face someone with smallpox. Fortunately, that burden has been lifted from shoulders of all physicians. Unfortunately, this viral scourge has been replaced by another one, and all of us in medicine and in society have to deal with the face of HIV on a regular basis, and it's certainly shaping our society today. In the 1970s, I saw the rise of the hospice movement. How exciting to have the end of life being treated with as much respect as our entrance into this world. Our exit out of this world is equally as important, and fortunately there are people who are helping this transition happen with skill and compassion. After 6 years in general practice, I wanted to go out and do some rural medicine. I'd done a lot of my growing up on my uncle's dairy farm in Wisconsin. I wanted to do rural medicine, but I knew 1 year of internal medicine did not equip me to be in some out-of-the-way emergency room when someone came in and put a chainsaw on their leg, and I was the only doc in the hospital. So I went back to Vancouver General and did 6-month training in anesthesiology, did 6 months of general surgery, 3 months of plastic surgery, 3 months of chest surgery, 3 months of orthopedic surgery to increase the arrows in my quiver here. I wanted to do 6 months of obstetrics to do a cesarean section if I really had to do one. Couldn't do that in Vancouver, so went down to University of California, San Francisco, and did 6 months as an obstetric resident. And then I found myself in the early 1980s. Exciting time, and still an innocent time. And I headed up to the redwood trees up in Humboldt County, California, near the Oregon border. We're in the Trinity Valley, in the Hoopa Valley, along the Trinity River, found a small hospital and began practicing medicine. On weekends, I would work in the emergency rooms in Hoopa Valley, and during the week, I would travel to the coast, to Arcata, California, worked at Mad River Hospital giving anesthetics. During those years, learned how to fly airplanes, and kindled in me a passion for aviation, which remains today. In the 1980s, I saw the advent of computers in medicine and watched in amazement as they infiltrated every aspect of medical practice, from the nursing station in the hospital to the operating room to the recovery room to the emergency room. Computers became ubiquitous at every nursing station and every doctor's office. And along with the computerization came amazing imaging technology, MRI scanners, CT scanners. And it was a tremendous relief when people came in the emergency room with a knee injury. I would examine the knee, and previously had to just rely on a plain x-ray of the bones, but with MRIs and CT scanners, we were allowed to see the soft tissues of the joint. Same thing, people came in head injuries, we'd do a neurologic examination, but basically we had to divine what's going on inside the skull from a plain x-ray, but with a CT scan, we're able to see the soft tissues. What an exciting time, what a gift to all physicians to have this imaging technology available to us. So the advent of laparoscopic surgery, when the huge abdominal incisions that I used to see made routinely for gallbladder procedures and other operations gave way to small keyhole incisions as doctors were able to do these amazing procedures through these tiny, tiny abdominal incisions. Saw the rise of specialties that never existed before when I entered medical school. Emergency medicine became its own specialty. Ambulances became mobile intensive care units, and patients could be intubated in their tracheas and have IV started and their hearts defibrillated before they even saw the emergency room door. I saw medicine move out of the hospital altogether into urgent care units. And you cut your hand, you don't even have to go to the hospital anymore, go to your neighborhood local urgent care center and get your hand sewed up. In the 80s, I saw the rise of the insurance companies as they infiltrated their tentacles into every aspect of medical practice. And And the specter of malpractice has come to dominate every medical decision I make. My malpractice lawyer is on my shoulder, screaming in my ear. If this patient has an adverse reaction to something you do or do not do, they're going to sue you for every penny you've got. And every physician has to deal with this specter today. I saw the co-option of important, valuable medications used for semi-nefarious purposes Anabolic steroids, which we use for people with pituitary failure and growth retardation, was used for reasons of money and ego. In the 80s and 90s, I saw things in medicine I never thought I would see. The marketing of powerful pharmaceutical medications directly to the public. And the ubiquitous phrase, ask your doctor if, fill in the blank, medication is right for you. Oh my. A pill for every ill. Depressed, no problem, just go see your doctor and he's got something for you to make you feel better. And people did, by droves. And then came the big oops, and we would find that these medications, when unleashed upon the public, often had effects that were bordering on disastrous. And medication after medication after medications are recalled as the potent adverse effects of these pills became evident. Back in 1972, when I graduated, doctors were not permitted to advertise their services. It was not only unethical, it was illegal in most states. Doctors were not allowed to advertise. The only advertising you could do was the name on the plaque of your office door, and it was only by word of mouth of your reputation that patients found out about your services. Well, that certainly changed in the 80s and 90s, and now you can't open up a telephone directory or a magazine on an airplane without seeing some advertisement for some physician's services. Most advertisements for doctor services, I must admit, are done with taste and modesty. Most of them, some of them not so much. One of the joys of being a GP was to direct my patients to the services of other specialists. Now, patients don't even need me to do that. They get on the internet and find their own specialist. As a result of all this societal upheaval and the society's views of doctors changed, I think the war had a lot to do with it when people saw medicine being used for political purposes and less than noble purposes. And consequently, it changed the image of physicians in the minds of the public. Kindly old Marcus Welby gave way to cynical Hawkeye Pierce, a battle-hardened surgeon who didn't hesitate to tell you what he thought of war and bureaucracy, or nor to show you his more human side. Marcus Welby would never do that. Old Trapper John, MD, battle-hardened but still soft-hearted. And we saw the young doctors from ER not only living their lives, but also in the operating room, the emergency room, screwing up and making mistakes and having to deal with the consequences, showing the mortal human side of physicians. And St. Elsewhere was a phrase you heard only at intern matching time when the one intern was out. I hope I don't wind up at St. Elsewhere, some bodunk hospital, and came to be synonymous with good medical practice. Me, I headed back to Vancouver in the early 1980s to pursue my training in anesthesiology. I was going to be an anesthesiologist. I had a real facility for it, and it's a wonderful, beautiful specialty. It's a real honor to come to someone the night before surgery. I really love being an anesthesia resident. You go to people who are facing surgery the next day, they're frightened, they're in pain, and to be able to assure them that they're going to get through the operation okay, to explain what's going to happen to them, to tell them I'm going to be watching over them as they go to sleep, I'll make sure everything goes okay, and I'll be there when they wake up. It's a real privilege to do anesthesia. When you give someone an intravenous induction agent and put them to sleep and you intubate their trachea and you're ventilating them, you've got their life force in your hands. You can, under your pulse, under your fingertips, you feel their pulse from their heart in the respirating bag. You can feel their breath. You have their entire life force in your hands. It's a real beautiful endeavor, and it's a privilege to do anesthesia. But it did put me in the operating room. And day after day after day, I, watching surgery, watch what surgeons do. And surgeons do wonderful things, but especially on the cardiovascular anesthesia service, I saw more than anything surgeons would open up arteries. And from those arteries, they would peel out this yellow, gucky, tenacious material called atherosclerosis. I'm going to show you a surgical slide here if the scene bothers you a bit, maybe you can avert your eyes, but here's a carotid artery being opened up, and you see the atherosclerotic material being peeled out of the inside of the artery. This procedure is an endarterectomy. And I began looking at this stuff. I said, what is this stuff? It is so lethal. It clogs off the very life flow to our hearts and our brains. What is this stuff? Could it be related to all the fat in the blood that I would see on patients who would eat a cheeseburger and then have their blood drawn and you could see the fat in their blood? Could it have something to do with all the fat then that wound up on my increasingly obese patients? Could it have something to do with all the fat that they're eating? This stuff looks like the same stuff they're pulling out of the arteries. And that eventually winds up taking their lives or putting them on my operating table. Day after day, month after month, 2 years of anesthesia, and had to watch this happen again and again and again. Finally, during my last year of anesthesia, I had 6 months to go. I had paid my money for my anesthesia board exams. I was 6 months away from becoming an anesthesiologist. I realized I could not do it anymore. This just was not my calling in my life. Blessings on all my anesthesia brethren, and that what they do is absolutely wonderful work. But I knew I couldn't do it any longer. I felt like a cog in the machine of this assembly line, patients coming through, getting a small amount of this stuff cleaned out of their arteries, but the rest of their artery tree is still packed with this stuff, and they go out and the process continues apace. It came to a head one day after a long procedure. We had done a patient with a 4-vessel coronary artery bypass and a ventricular aneurysm repair. A 7-hour procedure. It was 3 in the afternoon before the entire operating room team limped down to the cafeteria to get lunch. And as fate would have it, I'm pushing my tray down the cafeteria line right behind the surgeon that I had been helping. And this surgeon, nice man, skilled surgeon, but it was the fattest surgeon I had ever worked with. This man was just grossly obese, talented, but stubby fingers. And I watched with amazement as we're going through the line, and he proceeds to fill up his cafeteria tray with a double cheeseburger, a slice of cream pie, and a milkshake. And I look at this, and I'm thinking, I am working in a Fellini movie. This is bizarre. What does this man think he's been doing for the last 7 hours up in that operating room? And I realized I couldn't do anesthesia any longer. Besides, my patients were falling asleep on me in the middle of conversations. And as much as I enjoyed anesthesia, I knew I didn't want to spend the rest of my career putting people to sleep. I would rather go back to general practice and help them wake up. And so that's what I did. So I left anesthesia and I returned back to general practice. But I realized that what my patients were eating was very, very important in the diseases I was seeing. And I had some clues to that. And part of it came from my own evolution, because at that time, it was 1981, and I adopted a purely plant-based diet. I became a vegan. A number of reasons why. My dad died of clogged arteries, and I knew I was going to wind up on that operating table with that striker saw going up my sternum, and I didn't want to do that. I saw these people when they woke up, and they were very sore. And but it was beyond that. I had done my 4th-year medical student surgery training at the trauma unit at Bad Old Cook County Hospital in Chicago. And I saw what violence does to people. I saw the results of shotgun blasts at close range, stab wounds, the Saturday Night's 38 specials. And I knew I wanted to get the violence out of my life on every level. And one evening over a steak dinner, as I was pontificating to a friend about how I wanted to eliminate the violence from my life, he looked at me and said, well, that's all very nice, Michael, but if you want to eliminate the violence, you might start with that piece of flesh on your plate that you're eating, because it's your desire for that meat in your mouth that is paying somebody to kill that animal. You are paying for the death of this sentient being. And I got a little defensive. I was going to say something when I heard that little voice on my shoulder saying, you know, he's right. They say once you look behind the curtain, you can't pretend you don't know what's behind the curtain. You know? And he had just ripped the curtain down there. And it didn't take long before I had to look at my leather shoes and my leather belt, and I said, I can't pay for that any longer. These are non-leather shoes, and I don't have a belt. And my wallet is made of nylon. So I became a vegan for all sorts of reasons and noted some interesting things. A 20-pound spare tire of fat around my waist melted away. My blood pressure had been elevated, 150/90, dropped down to 110/70, where it remains today. And I felt great waking up in a nice, lean, light body every day. It was really a wonderful way to eat. Well, the word got out. By this time I was practicing in Florida, and word got out that I was a vegan physician. And I began being sought out by people who shared the same dietary practices that I did. And they began asking questions. Is this a safe and reasonable thing to do? Can I run my body on only plant foods? I didn't really know that. So I owed my patients some research, so I hit the medical literature and found indeed the concept had already appeared in the medical literature. A British pathologist, Frey Ellis, who's a vegan himself, started noting all the beneficial changes that occurred from a purely plant-based diet. Frank Sachs at Harvard noticed that vegetarians have much lower cholesterol levels and were at much lower risk for heart attacks and strokes. He also noted that vegetarians ran lower blood pressures, which has tremendous implications for avoiding vascular catastrophes. This is back in the 70s. We went into the study of Olof Lindahl in Sweden, who took patients with bronchial asthma and put them on a vegan diet back in '85, and noted, he took 35 patients, severe bronchial asthma, they're all receiving medications, 20 on prednisone. In almost all cases, medication was withdrawn or drastically reduced. There was a significant decrease in asthma symptoms from a vegan diet. It even affects your lungs. Then I encountered the study from Jens Kelsenkrog in Norway, who looked at autoimmune diseases. And he took a bunch of people that had red-hot rheumatoid arthritis and did a brief water fast with them and put them on a vegetarian diet. And noted after 4 weeks, the diet group showed significant improvement in the number of tender joints. Their blood tests got better. And the benefits in the diet were still present after a year. So pure vegan diet can benefit your joints. Amazing, entire body benefits. This is remarkable. So I said, yes, it's a reasonable thing to do. And in fact, it has very powerful therapeutic capabilities. Well, I needed a plan. And fortunately, someone had written one. That's just how I felt when I encountered this book. There was somebody else out there. And he could write, and he spelled out in plain English how people can do this for themselves. And so I began recommending his book, whoever this Dr. McDougall is. Thank bless you, wherever you are. And, but I needed some nuts and bolts medical information. What do you really do with patients with ulcerative colitis? What do you really do with patients with rheumatoid arthritis? And is there medical foundation for using a dietary program? And again, this amazing white knight out there had done his homework as well. And he wrote a book for doctors saying this is how, it's for the public, but boy, this is invaluable for a physician because he put all the medical scientific literature citations and actually did the homework that I needed to have done. And so, phew, I felt less alone, and I've had some authority to share this information with my patients. So I began getting, who is this guy? And so I said, I've got to go meet this man. And by this time, I was doing some speaking on the vegetarian circuit, and would go to various meetings. And back in 1984, almost 30 years ago, was able to have the privilege of meeting Dr. McDougall. And, you know, he's right. Every year he gets handsomer. But yes, he's right. It's been almost 30 years that I've had the honor to call Dr. McDougall my friend. Dr. McDougall, in his rebelliousness within his individuality and his relentless pursuit of the truth, awakened me, gave me courage as well. And it gave me the courage to look at my entire store of medical information and re-examine it. And it's summing up a phrase that I heard a long time ago from composer George Gershwin, who composed the American operetta Porgy and Bess. He wrote a song entitled, "Ain't Necessarily So." The things that your preacher is likely to teach you, ain't necessarily so. I had to look at everything that I had learned in the Temple of the Way It Is. Maybe it ain't the way it is. I had learned back then that ulcers of the stomach and the duodenum are caused by stress and too much acid in the stomach. It burns a hole in your stomach lining. And back then, if they had too much acid in the stomach, the only treatment was give them antacids, neutralize the stomach acid. And people would drink Maalox by the glass, and all the aluminum that it contained as well. I hate to think of what that did to their Alzheimer's risk. And back, because in 1972, in my internship in Canada, I was told by my GI professors up there that if it feels like it's on fire, then quench that fire. And the way you, 1970s, the way you quench the fire in the 1980s, especially up in Canada, was with half a cup of whipping cream every 4 hours. And I dutifully poured the whipping cream for my patients and gave it to them, as my professor told me to do. And all those patients out there, wherever you are, please forgive me for what I did to your coronary arteries. Fearsome disease, we had no idea what caused it. And I know in 1970, my internship, if I had asked my professor, could this be an infection with a bacteria that can live in stomach acid? 10th normal hydrochloric acid. Would there be a bacteria causing this? Do you know what they would have told me? If I had told them, should this be treated with antibiotics instead of antacids, you know what they would have told me? Hang your stethoscope on the door on the way out and enjoy your career as an insurance salesman. This is Dr. Barry Marshall. He was a medical researcher at the University of Western Australia in Perth, and back in the late 70s, early 80s, did some landmark research. He did indeed identify a bacteria, Helicobacter pylori, that indeed can live on the surface of the stomach in 10th normal hydrochloric acid and can indeed burrow a hole in your stomach lining and cause an ulcer. And Dr. Marshall did the landmark, brave, and pioneering work of preparing a solution of Helicobacter bacteria and drinking it himself. This, in turn, predictably gave him a rip-roaring gastric ulcer, which he then treated successfully with antibiotics and cured his own ulcer with antibiotics, showing that indeed this bacteria is the cause in the majority of ulcers in the stomach and the duodenum. Wrote his paper, and this is Dr. Barry Marshall receiving a Nobel Prize for his work. So indeed, made me re-examine everything that I had learned. And now treatment of ulcers with antibiotics has become the standard of care. What else can George tell me about the way it is? Atherosclerosis is a relentlessly progressive, irreversible disease. Really? So what happens? Blood is going through an artery, and this yellow atherosclerotic guck starts building up and encroaching on the blood flow channel, choking off blood flow. Irreversible. There's nothing you can do about this. Nothing stops this process. Really? George has a different idea. Dr. Dean Ornish showed that indeed this disease is eminently reversible, and even though the artery is closing down, if you get the person on a purely plant-based diet, relieve their stress and levels with various modalities, this stuff begins to melt away, and the disease absolutely is reversible. Dr. Ornish published his first study in 1983, and this has slowly but steadily become generally accepted in both the, certainly among the public, and even begrudgingly among medical professionals are starting to realize that this is a reversible disease. But when someone's got arteries so choked down like this, it was going to take years and years to melt all this away, right? Not necessarily so. In fact, not necessary to melt this away altogether at all. Why? Because of a law in physics described by a French physicist, Poiseuille. Poiseuille said that the quantity of a liquid, like blood, flowing through a blood vessel increases, hang on, I'll explain what this means, by the fourth power of the increase of the radius of the blood vessel. And that means if you've got a blood vessel, if you double the size of the blood vessel, the flow of the blood going through it doesn't just double, it goes up by the fourth power of the increase of the radius. So if the radius of the blood vessel increases by a factor of 2, the flow of blood going through it increases by a factor of 2 times 2 times 2 times 2 by a factor of 16. And you know this, if you're sucking up a liquid through a small straw, even increasing the diameter by a factor of 2 means a huge increase in the amount of the liquid going through the pipe. And for that reason, you don't have to melt away all this plaque. If you can just melt away just a little bit of it, you get a tremendous increase in blood flow. And we find people within weeks of starting this program, their angina goes away. They're able to walk without chest pain. Their leg pain goes away. And this has been a real blessing and a tremendous motivator for people to get on with improving their diet and lifestyle. And we begin to see that this trend has continued, and it's great to see Dr. Ornish doing his great work. He brought this information to the public, and the public is way ahead of the doctors on this one. And recently, he's been bringing our attention to the importance of the cells that line the arteries, and they are absolutely key in helping arteries stay healthy and dilate and allowing blood flow. And Dr. Caldwell Esselstyn has taken this concept even further and come up with a really powerful program for reversing heart disease. High blood pressure, pounding away at those arteries, heartbeat after heartbeat. The dogma from I learned at the temple the way it is that if you put a patient on antihypertensive medication, they'll take these pills the rest of their life. Nobody gets off of them. Oh yeah? Maybe not. It's been well shown now that when a person adopts a plant-based diet, they do major changes in the tone of the artery walls. The increased potassium level in plants versus animals allows the blood vessels to dilate. When you remove the fats from the cheese and the meats and the olive oil that used to coat the red blood cells and make the blood sticky and viscous, on a whole foods plant-based diet, the blood is less viscous. You can push it through the capillaries with much lower pressure, and indeed blood pressures do go down on a plant-based diet. And Dr. Neil Barnard has documented this as well. Diabetes. Oh, one's on insulin, always on insulin. Maybe not. Ain't necessarily so. Many of you are familiar with this, but here's a muscle cell, and our muscle cells burn sugar called glucose, and you got to get the sugar into the cells in order to burn them. And there's little doorways, if you will, on the surface of the cell that has to be opened to allow the sugar in. And what allows those little doorways to open is a molecule called insulin, and you need that to get the glucose into the cell. But if there's so much fat in your diet, and if the muscle cells are all filled with fat called intramyocellular lipid, intra is inside, myo is muscle, cellular cells, lipids, so intramyocellular lipid, this is fat inside of muscle cells. The fat clogs up the insulin receptors, so the insulin doesn't work, so the blood sugar piles up out in the bloodstream, and people have signs of diabetes. Well, get people on a whole food plant-based diet and yank out not only the meat and the cheese, but the olive oil and all the fats, and this stuff disappears, the insulin receptors open up, and diabetes goes away. Here you can see the intramyocellular lipid, and here are muscle cells. Here is that stuff clogging up the insulin receptors. Well, this stuff clears out, and people with type 2 diabetes, we don't use the term adult onset anymore because we see it in kids so often these days who are getting so obese. But you can see the intramyocellular lipid here that melts away and allows the resolution of type 2 diabetes. This is now becoming common knowledge. And Dr. Barnard and his colleagues worked with this, put people on a pure vegan diet for a year and a half, and found after a year and a half, this is their how much of their blood is sticky with sugar, how much of the hemoglobin is sticky with sugar. That decreases. Here's their weight goes down on a vegan diet. Their bad cholesterol goes down. It's a really very beneficial diet for folks with type 2 diabetes. But something caught my eye, and that is people with type 1 diabetes, where the pancreas has been injured and they don't put out insulin. Type 2 diabetes, folks make lots of insulin, it just doesn't work out in the muscle cells. Here, the type 1 diabetes, their pancreas has been injured and they don't make the insulin. But noted that these kids have increased antibodies in their bloodstream against a protein in cow's milk, casein, beta-lactoglobulin. These are big molecules. Casein is 199 amino acids long. How's that getting out into the bloodstream? Beta-lactoglobulin, 324 amino acids long. Now, these are big proteins. How are they getting out into the bloodstream? People with celiac disease, they have antibodies in their blood against a fragment of wheat gluten. This is a pretty hefty molecule. How's it getting out into the bloodstream? I was told this didn't happen. Made me think about the studies I had read regarding rheumatoid arthritis. Dr. Kelsen-Grog took his folks and he gave them a water fast, but he put on that a vegetarian diet helped at all. Says there's something going on. How can the people's diet be affecting their joints? I was told rheumatoid arthritis is an autoimmune disease of unknown origin, and diet has no effect on arthritis. In fact, if you go to the Arthritis Society today, you'll be told diet has no effect on arthritis. Why would that be? Well, as I learned at the Temple of the Way It Is, protein fragments are too big to pass across the intestinal membrane into the bloodstream. Therefore, diet can have no effect upon arthritis. Oh yeah? Maybe not. Maybe not necessarily so. Because I'm clearly seeing big proteins are getting into the bloodstream. How is this happening? What's going on here? Could the gut and the joints be related? Well, this pursuit took me down the rabbit hole. I really wanted to figure this out. But the rabbit hole that I was looking at didn't look quite so much like this as it did that. This is the intestinal tract, and I realized there's something important happening in this membrane. You know the saying, you are what you eat? It's wrong. You are what you absorb. The materials have to get across the intestinal membrane into your bloodstream to have any effect. So let's look a bit closer at the intestinal membrane that allows this absorption to happen. Amazing structure. And if the intestine is 30 feet long, you slice it open, and you see it has the inside of the small intestine has these elegant longitudinal folds that have these finger-like projections sticking up called villi. They're amazing structures. Under electron microscope, here's what the villi look like, and their purpose is to increase the absorptive area of the small intestine, and they do a great job of it. If you were to open up the intestine and flatten it down, and flatten down every one of these villi, and spread the absorptive area over one flat plane, the surface area for absorption in each one of our intestines would cover half the area of an NFL football field. That is the absorptive area we each have in our intestinal tract. Now, if you look at the villi under the microscope, you see that in the walls of the villi are these large cells called goblet cells. And the goblet cells secrete mucus. Ooh, mucus, yucko. No, thank God for that mucus. That allows your food to slide along the intestinal membranes and allow absorption of your nutrients to happen. And here we see it represented schematically. Here's three villi sticking up. This blue material is the mucus. But think of where we are. We're down in the intestine. It's dark, it's moist, it's warm. The mucus is full of sugars. What a great place to grow microbes, more bacteria and yeast, and that's exactly what happens. A rich population of microbes establishes itself in the intestinal mucus. They have wonderful names. The names of the organisms are like all of science. They're mellifluous. They're sweet-sounding on the tongue. I just love medical terminology. You have organisms like Bifidobacterium longum. Lovely name. Bifidobacteria. Why do they call it bifidobacteria? Because under the microscope, when you look at them, they're bifid. Bifidobacterium longum. Why do they call them longum? Because they're long. Lactobacillus salivarius, lactobacillus. That tells us this bacteria ferments sugars not into alcohol but into lactic acid. And lactic acid curdles milk. And it's a bacillus. That says it's rod-shaped. When you see the word bacillus, you're talking about a rod-shaped bacteria. That differs from cocci, which are round. The Greek term staphylos means clumped like a bunch of grapes. And so the bacteria, the cocci that are clumped like a bunch of grapes, are staphylococcus. Okay, you've heard of staph infection. This is really what they're talking about, the staphylococcus, like clumped like a bunch of grapes. This is in contrast to streptococci. Strepto means long chain, twisted into chains, and this is big bad old streptococcus. And again, the name tells you what the bacteria looks like. Lactobacillus salivarius is near saliva. We swallow it and populates our intestinal tract. Lactobacillus casei, you Latin scholars and Spanish speakers will know casei is a Latin word for cheese, and queso in Spanish is cheese. And indeed, it is the bacteria that cheesemakers add to their soft cheeses to turn them into hard cheeses. Lactobacillus acidophilus, the acid-loving bacteria. This bacteria produces acids that kills off the competition, but it doesn't kill off Lactobacillus acidophilus. It thrives in an acidic pH. There are beneficial yeast down in the intestinal tract, like Saccharomyces cerevisiae. Saccharo means sugars, myces is a fungus. So you know it's a fungus that grows on sugars. Cerevisiae, interesting word. Ceres was the Greek goddess of grains. You know, cereal is where the word cereal comes from, so something grainy is involved. But the key letter here is V. You Spanish speakers will know that the Spanish word cerveza means beer, and indeed Saccharomyces cerevisiae is brewer's yeast, and this is seen to appear when you are making beer and the yeast is fermenting the sugars in the barley malt. A mat of Saccharomyces will develop on the surface of the brewing vat. This is skimmed off and compressed into cakes because it's so rich in B vitamins. Not vitamin B12, but all the other B vitamins are in brewer's yeast. And it's been used for decades as a nutritional supplement. But if you ever tasted brewer's yeast, it's got a pretty foul taste to it. And the folks in the natural food industry wanted to get the vitamins out of them, the vitamin benefit, without that brewery taste. So they take the same organism, Saccharomyces cerevisiae, and they grow it on a solution of dilute molasses. It doesn't ferment, but a luxurious mat of this wonderful yellow yeast develops on top of the molasses. This is skimmed off, powdered and dried, and sold in the health food store as nutritional yeast. Same organism, just never saw the inside of a brewery. Saccharomyces boulardii, described by the French microbiologist Henri Boulard, and this is great for stopping diarrhea. So these are just some of the many, many organisms that live in our intestinal tract. They have very important functions. They break down the fiber in oatmeal and other fibrous vegetables to short-chain fatty acids to fuel the very structures that they are living on. They fuel the villi. These organisms produce vitamin K. K is the first letter for the German word Coagulation. This is needed to clot your blood. Every time you cut yourself and you stop bleeding, say thank you to the microorganisms living in your intestinal tract for making vitamin K. They also make biotin to metabolize your amino acids. But their very presence prevents other nasty organisms from setting up housekeeping in your gut lining and causing problems. Here you see it represented schematically. Here's the villi, here's the good bacteria, Lactobacillus acidophilus and casei, etc. But lurking in this mucus layer are some unfriendly organisms, Candida yeast, Clostridia bacteria, and these guys are not so friendly. They can damage the lining of the intestinal tract. Now, we used to constantly, when we were a couple hundred years ago living Earth-connected lives, we were constantly refreshing our bacterial organisms. You pull out a carrot from the garden, wipe it off on your pants leg and eat it, and you'd get these soil organisms that were the very ones that living in the intestinal tract. You wanted to drink, you find the nearest stream and lay down and drink stream water. You would get these beneficial organisms. When towns dug municipal wells, you'd get the organisms from the well water. But welcome to the 21st century. Modern life is an assault on our intestinal microbes. Think about it. Every time you turn on the tap, what comes out but water that's been treated in the municipal drinking water plant where they add chlorine. I'm not against chlorinating the drinking water supplies. I don't want to be treating cases of cholera and typhoid fever. But every cup of coffee that you make with tap water is a dilute chlorine solution. Doesn't do great things for your intestinal bacteria. If you're a fan of soft drinks, what gives these cola drinks the bite on the tongue is phosphoric acid, and these are solutions of phosphoric acid. Don't do great things for your intestinal tract when you drink them. Coffee and tea are bactericidal agents. So the coffee oils are potent destroyers of bacteria, and if you live in Seattle, you'll drink 22 cups a day of this stuff. And the tannic acid in tea is such a potent antibacterial agent that you can cure an eye infection with a wet tea bag because the tannic acid will kill bacteria. Even herbal teas have antibacterial properties to them. Unless you're eating 100% organic produce, the fruits and vegetables have been sprayed with herbicides that are specifically designed to mess up the enzyme systems of plants, which many of these microbes are. And that glass of wine with dinner is a glass of alcohol. In the hospital, we dip our surgical instruments into alcohol to kill bacteria, and here we are drinking the stuff, and that doesn't do great things for our intestinal tract. And then finally, when you have a runny nose or a scratchy throat these days, you go to the doctor and beg them or threaten them until they pull out their prescription pad and give you a prescription for amoxicillin or Cipro. These are potent drugs, and they can't tell the good germs from the bad germs, and they kill off organisms that should be there. And I want to make a point about this, just to give some people an important scientific concept. In any complex system, whether it's the human body or a river valley, you can't do one thing. Can't do just one thing. We're damming this river for flood control. Well, that's what you think you're doing. But especially if you're in the tropics, you're backing up stagnant water, which is going to increase the mosquito population, which is going to increase the malaria incidence, which is going to make you spray pesticides, it's going to kill off the beneficial insects, we're going to have pathogenic insects invade the barks of the trees, kill off the trees, increase the stream erosion. You can't do one thing. Everything's interconnected. In the body, the doctor says, I'm giving this trial an antibiotic to cure his ear infection. Well, that's what you think you're doing, doctor, but you're also killing off the good bacteria, which allows the pathogenic organisms to establish themselves, which injures the gut lining, which allows food proteins to leak into the bloodstream, which flows through the joint membrane to sets off inflammation. You can't do one thing. Even taking a vitamin tablet, you're setting off a chain of reactions. So please, save antibiotics for true bacterial infections, and don't ask your doctor next time you have a cold for antibiotics just in case. You're going to create more harm than good. So here we are, killing off the good organisms, and then once we've knocked down the good guys and selected out the antibiotic-resistant tough bacteria and yeast, what do? Then we add a little bit of sugar, okay, and we make them grow, the bad guys. Now, I'm not talking about half a teaspoon of sugar in your tea. That is not the problem. That's using sweeteners as they were designed as a flavoring. That's okay. The problem is eating sugar as a food. Eat sugar as a food? Who sits down at a sugar bowl and eats sugar as a food? Nobody does that. I don't know anybody who eats sugar as a food. Do you know anybody? I can't imagine anybody eating sugar as a food. Who in the world would eat sugar as a food? I don't know who would eat sugar as a food. Do you know anybody who eats sugar as a food? I don't. Folks have no illusion. When you're walking past a bakery and that lovely warm aroma comes up your nose, they have no illusion what they're doing in there. They're baking sugar in there. They may add flour and eggs and water to it, but they're baking sugar in there, and they want you to come in and eat a big chunk of it. Even if you add milk to it and freeze it, it's still sugar. Don't eat it as a food, but we do in massive amounts. We certainly drink it. This is an 8-ounce can of Coke, a little 8-ounce can of Coke. Cokes used to come in 8-ounce cans. 8-ounce can of Coke, 5.5 teaspoons of sugar in a little 8-ounce can of Coke. Nobody drinks 8-ounce can of Coke anymore. They're now quart bottles. 13 teaspoons of sugar in a quart bottle of cola drinks. Americans are consuming almost a gallon a week. Since I'm not drinking any, somebody's drinking 92 gallons. And, this is food porn, if you have not seen it. Just add a little sugar, and voila, you too can create an intestinal tract that looks like this. This is an intestinal tract slathered with candida yeast. This is intestinal candidiasis. The technical name, this is a dysbiosis. Dys means bad, bios is life. And the problem with that is this. Here's the wall of your intestine. Here's food going by up top here. And here's the bloodstream down there. The job of the intestine is to extract nutrients from the food stream into the bloodstream. And healthy intestines do this, but they also have an important barrier function. There's a lot of things going by in the food stream you do not want in your bloodstream. Undigested food proteins, the breakdown products of bacteria, yeast. You don't want that in your bloodstream. And a healthy intestinal lining will not allow that to happen. But you kill off the good organisms in the lining here, and you feed the bad guys, and you let candida and other organisms set up housekeeping here. They injure this gut lining. And this lovely barrier function turns into this, and molecular spaces open up between the cells, and big molecules that have no business in your bloodstream start leaking down into your bloodstream. There's a so-called leaky gut syndrome. This funny name, not a funny condition at all, because this sets off lots of problems. Here you see it represented schematically. And here's big food proteins and bacterial products getting into the bloodstream. And as these nasty molecules flow through your joint membranes, your kidneys, they set off problems. They may incite autoimmune diseases, inflammatory arthritis, rheumatoid arthritis, ankylosing spondylitis. This is how those big molecules are getting into the bloodstream and setting off the antibody response. May set off autoimmune diseases like lupus. Makes allergies worse. It flows through your nasal membranes. These membranes react when pollen lands on them, so the hay fever gets worse. Bronchial membranes swell, asthma gets worse. People get hives in their skin. Leaky gut syndrome sets off a lot of problems. We knew this a long time ago. In 1954, it was clear that people with inflamed gut linings get sore joints. We knew it back then. Here was the leaky gut syndrome announcing itself, but we didn't recognize it. But now we're starting to see that reactive arthritis is a recognized sequelae of intestinal inflammation. Here we see normal bowel permeability and various rheumatoid diseases. Here we see it again, showing up 2009. Gut inflammation and the spinal arthropathies, again, more joint inflammation. Same thing, classic. This is juvenile rheumatoid arthritis. I'm not making this stuff up. It's finally percolating into the gut, into the medical literature. Here showing up in ankylosing spondylitis. Here it is, showing up type 1 diabetes as well. So there's indeed a connection between the gut, the joints, and all the other organisms. Has a role in food allergy as well, autoimmune diseases like Gaucher syndrome. By the way, speaking of leaky guts, one thing that makes your gut leaky are non-steroidal anti-inflammatories like ibuprofen. It makes sure it injures the gut and allows the gut to become leaky. And who's taking the ibuprofen? The folks with the arthritis. And so they take more ibuprofen and it makes their gut leakier and their joints get worse. So they take more ibuprofen and it goes around and around. If you have true need for an anti-inflammatory, for a non-steroidal anti-inflammatory, the only two that do not make your gut leaky are good old-fashioned aspirin. And one called Imubitone. This is a generic Relifen. And if you really have an inflammation that you need to snuff out, ask your doctor to give you a prescription for generic Relifen, or just take enteric-coated aspirin as well. So how do you know if you have leaky gut? Be a scientist. Test for it. People I got leaky gut. How do you know? Test for it. How do you test for it? is an intestinal permeability test. Basically, you drink a solution of 2 sugars, lactulose and mannitol. Mannitol shows up in the urine. Lactulose does not show up in the urine. If it shows up in the urine, you got a leaky gut by definition. There's some good science behind this. And here's the test you get back. This one's from Genova Labs. I have no connection with the laboratory, but $77, doesn't cost much. You drink the solutions of urine, drink the solution of sugar, send them some urine, and they look for the lactulose in there. You notice here's a result you get back. The normal range for lactulose is none, and that's why the green is all the way over to the left. They'll give you 1.5% lactulose that you drink showing up in your urine at the most. This fellow had 3% of the lactulose showing up in his urine. By definition, he's got a leaky gut. So what do you do if you have one? Fix it. You grow a new gut lining every 6 weeks, so help it come in nice and tight and healthy. Stop injuring it. Stop drinking alcohol. Stop eating sugars of food. Stop taking antibiotics for colds. If you're reacting to food leaking out into your bloodstream, yank them out of there. Stop putting dairy protein, wheat protein down there. And then help that gut lining come in nice and tight and strong. You do this with 3 supplements you get at the health food store. It's going to go by a little quick. You can review this on the internet when you review the entire program here. But at the health food store, get yourself a bioflavonoid called quercetin and take 1,000 milligrams twice a day. It helps the leaky gut tighten up. There's an amino acid called glutamine, 1,000 milligrams twice a day. Helps the gut lining come in nice and strong and healthy. And then after you've healed up the gut lining, you want to layer down a carpet of good organisms. So get yourself a probiotic. Pro means for, bios is life. These are the good guy organisms, but it has some substances in it to help the organisms grow better. And this is starting to percolate into the medical literature, and we're seeing that there is indeed a role for probiotics in a lot of medical diseases here. Now, these probiotics should have all these good organisms that I described, but there's a couple that you should look for if you have specific medical conditions. The label on the probiotic should have Lactobacillus acidophilus. It's very good for general GI support, but if you have irritable bowel syndrome, notice you want 60 billion organisms per dose, which is why I think eating yogurt is a joke. If you want beneficial bacteria, go and buy a probiotic. Don't use yogurt where you have to eat all this milk protein and sugar just to get some probiotics. You want some organisms, go buy them and eat them. If you are someone suffering from diarrhea after taking antibiotics, or if you've come back from Tijuana, you're going to want some Saccharomyces boulardii. In fact, it's great to prevent. If you're going to a place there where the water supply is dubious, start taking the Saccharomyces boulardii before you go. Take it every day while you're there and for a few days when you come back. If you're someone with Crohn's disease or colitis or irritable bowel syndrome, you're going to want Lactobacillus plantaris in your probiotic. It's especially good for inflammatory bowel disease. And if you're someone with a strong family history of colon cancer, you want to make sure your probiotic has Lactobacillus rhamnosus in it. It suppresses the factors that promote colon cancer. So you go into the health food store, you see 50 different brands of probiotics. And I'm always asked, is this one any good? Is this one any good? Well, more important question is your probiotic alive? Okay? These are live organisms. Now, they may have been alive when they left the factory in Omaha, but if it was stored in an unrefrigerated warehouse in Indianapolis on an unrefrigerated pallet for 6 weeks and shipped on an unrefrigerated truck, by the time it gets to the health food store, it may be dead powder. How do you know the stuff is alive? That's the key. To tell if it's alive, you open up the jar, you yell loudly into the jar, "Are you alive in there?" And no, I'm just kidding you. That's not really how you tell. What you do is you test it. Lactobacillus is the bacteria that curdles milk. This is how you make yogurt. So, a little simple kitchen chemistry experiment. Get yourself a couple of cereal bowls, a couple of coffee cups. In each of the bowls, pour in a little bit of dairy cow's milk. You're not going to drink it. Or soy milk will work, and dairy milk does work better. And in one of the bowls, open up 3 or 4 capsules of your probiotic and put the powder in the milk or a half a teaspoon of the liquid probiotic and stir it into the milk with a fork. And if it's a tablet, you got to crush them up. Don't put a whole tablet in there. You got to crush them up to a powder. Okay. Let both bowls sit out at room temperature overnight. The next morning, when you swirl it around, both bowls should not look the same. The bowl with the acidophilus should have signs of bacterial activity. After 24 hours, you should see either chunks of curdled milk, you should see a film of yogurt over the top, or you should see some bubbles, carbon dioxide. If you put your nose down there, it should smell like sour milk. If they both look the same after 24 hours, let them sit out one more night. And after 48 hours, there's an obvious sign of bacterial activity. You got dead powder there. Go get some stuff that can curdle milk. That's how you tell. When to take probiotics. Take them either an hour before you eat or 2 hours after. Why? Because when you eat, your stomach fills up with hydrochloric acid, and it's magical thinking to think you can drop live bacteria into the stomach and have them swim through this acid pool to get down to populate your intestinal tract. So sneak the bacteria through either before you eat or a couple hours after you eat. Well, so here we are now in the 1990s and 2000s, and I see nutritional medicine coming to the fore. And I found ideas that were new yet old. I learned that olive oil is not healthy for you. Refined oils are liquid fats. They are the white sugar of the fat world. They are not healthy for you. And with olive oil, corn oil, peanut oil, they are junk food. And they not only make you fat, but they have pharmacological properties. Fats are the key in turning on inflammatory reactions and in turning them off. You say, who else to turn on an inflammatory reaction? Well, if you get a sliver in your leg, you certainly want inflammatory reaction. It brings in white blood cells, eats up the germs, starts the healing happen, and it hurts, so it makes you look and pull the sliver out. Once the sliver is out, you want to turn off the inflammatory reactions, and that's what the fats in the diet do. Here are two fats. This is linolenic acid. This is in flax oil and in dark green leafy vegetables. This is the alpha end of the fat. This is the omega end. And we're interested in the double bond, the two electron pairs here. Where do you run into the first double bond? At carbon atom number 1, 2, 3, so that makes us an omega-3 fatty acid. And if you run into the first double bond here in linoleic acid in corn oil, you run into the first double bond, carbon atom number 1, 2, 3, 4, 5, 6. That makes us an omega-6 fatty acid. So what? Well, the so what is that in general, omega-3 fats are anti-inflammatory. They turn off inflammatory reactions, where omega-6 turn on the inflammatory reaction. So if you're someone with an inflammatory condition going on in your body, for anything from rheumatoid arthritis to asthma, you want to emphasize the omega-3s. Hippocrates said, let food be thy medicine. Here is the place to do that. And so you want those omega-3 rich foods like walnuts and flax seeds and pumpkin seeds. This is helping your food actually help the healing happen. Dark green leafy vegetables are rich in omega-3s, and they should be a part of at least everybody's meal, at least once a day, if not twice a day. There are fats you want to avoid. If you bubble hydrogen gas through liquid oil, it starts getting heavier and turns into Crisco. It turns into solid fat that is full of cell-injuring trans fatty acids. So if you see the word hydrogenated anything, parts hydrogenated, don't eat it. Here's palm oil, soybean oil, cottonseed oil, these cheap, junky industrial oils. Don't eat them. They're full of trans fatty acids, and that's what the fast food industry has capitalized on. And if Homer Simpson likes them, you probably shouldn't. So what do you do about it? You want to favor omega-3s over omega-6s, greens and flax and walnuts, etc. If you want extra omega-3 fats, get DHA, which is long-chain fatty acid, comes from algae. Now, leave the fish out of it. We're running out of fish. This is where the fish get it, from algae. You can get algae-derived DHA at the health food store if you want extra omega-3s. And read labels, avoid junky oils, especially partially hydrogenated ones. Eat food, basically, cut through it all. Eat food as grown, as Dr. Hans Steele says. If you want corn, eat corn on the cob. It looks like corn. Corn chips do not look like corn. Okay? Potatoes are okay. Potato chips don't look like potatoes. Okay? Eat food as grown. Well, at this stage, I find myself in the presence of some real pioneers in nutritional medicine who encountered this reality. As John Mackey told us last night, all truth passed through 3 stages. First, they are ridiculed, ignored, then ridiculed. Then they're violently opposed, and finally, they're accepted as being self-evident. We knew it all the time. And so I have nothing but respect for my fellow colleagues on the cutting edge here, Dr. John McDougall and Mary. Dr. Colin Campbell, Dr. Caldwell Esselstyn. These people have taken a lot of grief for their beliefs, but they know they're right. The Texas Rangers say you can't, there's no stopping a man who knows he's right and keeps on coming. And my colleagues certainly fall into that. Dr. Joel Furman, who we saw yesterday, Dr. Alan Goldhammer. My friend John Robbins wrote a awakening book for many people, Diet for New America, and I've been privileged to have John as a friend of mine for many years. River Phoenix was also a friend of mine. Dietitians, vegans, Brenda Davis, Visanto Molina, doing pioneering work, all taking a lot of grief. My colleague Jeff Novick, who many of you know and hold in great affection, as do I. Jeff told me the importance of getting information out of labels. He said, when you look at a label, there should be 1 milligram of sodium for every calorie. Look at, here's a can of soup, half a cup of soup, 90 calories. There should be 90 milligrams of sodium in it. 710 made me realize what processed foods really are. So here we are in the age of modern medicine. The internet has certainly permeated all our lives, physicians and patients alike. Information is available in huge amounts to anyone with a mouse and a computer screen. And there's a website for every possible area of medical interest. Nowadays, don't need doctors at all. Just go right to the internet and order your medications. Nowadays, everybody knows their cholesterol levels. Nobody knew it when I graduated med school. Everybody knows their HDL numbers now. Boy, you see a lot less of that. That's really good to see. Saw a phenomenon now called medical tourism. Now it's cheaper to fly to India or Thailand to get your heart surgery done. Quite a commentary on where American medicine has gone. We now see integrative medicine, the expansion, the incorporation of all sorts of modalities into healing. Here at the University of Arizona, their program, Integrative Medicine. UCSF here in San Francisco has integrative medicine for the public. Textbooks now on it. Your NIH, National Institute of Health, has a Center for Complementary Alternative Medicine. So, old treatments have come back. Acupuncture has been seen as a valuable modality in some cases, and people are relying more on natural therapies. Food has forced its way into our awareness, and we've seen now, it's almost weekly, we see some animal product being recalled due to bacterial contamination. Fortunately, there's been a rise of organic and vegetarian foods, and I am so deeply grateful to John Mackey and the staff at Whole Foods for incorporating that important combination of healing and foods. They realize to have a grocery store aware that food is medicine and actively trying to promote this is a benefit to us all, and veggie burgers are now ubiquitous. What an exciting thing to finally see the acceptance to have on this magazine, the rise of the power vegan diet. Look at that. Whoever thought we'd see that. And as we heard yesterday, even Medicare has realized it's cheaper to prevent and reverse diseases than operate on them, and now Medicare pays for Ornish and Pritikin. Also got our noses bloodied and realized that it's because it's natural doesn't necessarily mean it's healthy, and it ain't necessarily so, says George, and as Dr. McDougall said and Dr. Furman said yesterday, it's okay to eat a carrot. A whole carrot has beta-carotene, alpha-carotene, gamma-carotene, epsilon-carotenes. It's okay to eat them in concert in natural form. But you isolate, you pull out one of these substances and concentrate it, it becomes a drug, and it has adverse effects. Beta-carotenes will increase the risk of heart failure and cardiac death. Vitamin A alone increases the risk of bone fractures. Vitamin E increases the risk of cardiac death. These are not safe to be taken on their own. Folic acid increases the risk of breast cancer in women, prostate cancer in men. Not folate in green vegetables. That's what you're supposed to be eating. But folic acid, oh, they're the same. No, they're not. And they cause problems. I joined the staff at True North Clinic about a mile from here, and it's a nutritionally based clinic where we use vegan nutrition to help reverse serious diseases. But we also supervise medical fasting there. What a powerful modality. If there was a pill that did what 21 days on water does for you, it knocks down high blood pressure, cleans out your insulin receptors, lets autoimmune inflammation subside, opens up your coronary arteries, lets bowel inflammation subside. What a powerful modality that should be studied more. So where are we going? What's the future of medicine? We had a little glimpse of it on Star Trek. Dr. Spock would take out his scanner and determine what was happening in the body. Nowadays, every emergency room resident has an ultrasound scanner in their pocket and able to determine basically the same thing Mr. Spock did and send it to their smartphone or a smartphone to a specialist across the country. Now the internet has permeated all our medical practices, and I practice very active telemedicine. I'll do Skype consults with patients so I can see what they look like, and it's a blessing to be able to show a skin rash to a dermatologist in Boston and have them help you with the diagnosis. And nowadays, even surgery is done long distance. The surgeon can be in Boston and the patient in Nairobi, and the patient in Africa gets the benefit of modern medical care. And now on the forefront is possibly even growing new body parts altogether. But, as Thomas Edison said, the doctor of the future will give no medicine, but will interest his patient in diet and the cause and prevention of disease, and we better do it because we have a tsunami of obesity bearing down on us that is going to bankrupt our system unless we get serious about preventing these diseases. And again, kudos to Whole Foods and others that are trying to awaken us to the importance of healthy eating. So, here we are as physicians. How we practice medicine is going to determine how we are perceived. We're going to be perceived as as doctors who actually care and connect with our patients. Otherwise, the image is going to be one of a semi-psychotic, lecherous, drug-taking psychopath. I prefer to focus on the best of medicine. I've seen the plastic surgeons and anesthetists at Operation Smile transform children's lives in 45 minutes. And this is the best that medicine has to offer. Doctors Without Borders goes into these dreadful battle zones and practices the best medicine on the planet. And it's such a noble and beautiful profession. Nice to see spirituality finally coming back into medicine. It should never have left in the first place. And now it's finally being honored that we are spiritual beings in a human body, not a human body with a spirit. Medicine has always been about connection. It's about human beings caring about each other, helping each other. Ultimately, it's about love. And because of where I am now, it's about the future. There is a whole generation of new physicians coming up. And I, at this stage in my career, proudly put on the mantle of teacher. And it's my honor to help the younger physicians become aware of the power of nutrition, the power of nutritional medicine, and to help them come into a truly healing profession, which I look forward to staying in for my next 40 years in medicine. Thank you very much.
I think that says it all, Michael. Great job. Thank you. Let's take about a 7-minute break and get right back to work.